First, could you tell me, thank you for doing this once again. Could you tell me what your position is, by the way?
I am the Ingham County Health Officer.
The Ingham County Health Officer. Okay,
Mhm.
um, so there have been a few coronavirus, I'm not going to say incidents, but there have been a few cases linked to certain areas. I know one was connected to the Okemos High School graduation. First of all, and I think it was this past weekend that the student tested positive. How's the contact tracing going, first of all?
The contact tracing is going well. I mean, we know who the individual is. Then we start to, basically be in touch with anybody that was in close contact with that individual. Fortunately, from what I hear, most people stayed in cars. And even this individual was my understanding, not even out of the car for very long. So we're hoping for this to be a low risk exposure, but time will tell.
How does it make it harder when you tested positive at a drive-in event because you don't, I mean, yes, you probably know who's there, the student does, but you don't really see them. They're in the cars. Does that make it harder?
Well, here's the thing. So for anybody that got out of their car, right, and was in close proximity to this individual for any given point of time, that's our contact tracing. For those who stayed in their cars, they're not contacts. They were not in close proximity right next to an individual who was potentially infectious at the time, for a prolonged period of time in order to have an exposure risk. So to the extent that people stayed in cars, that is not a contact tracing issue. So similar to what we did with a recent large outbreak, if we do our contact tracing with this and start to discover, lots of people were out of their cars, or, this individual was with a cluster of friends, but then there were others nearby, and then we can't even, necessarily name all of the names of those folks, that's when we do a public notification to say that there's an exposure. But again, most people stayed in their cars. Some did get out. And then it's a matter of to what extent does an individual who may have been there that then tested positive, to what extent was that person not in their car, and to what extent were they in contact with anybody else closely for a prolonged period of time. So those are the people that we get in touch with, and then basically, do you have symptoms? And then those individuals are asked to quarantine for 14 days.
How many people have you guys been able to contact trace so far?
I can't tell you that number. Our contact tracers are so busy with so many things. I don't have contact tracing numbers. I mean, clearly when we're identifying, 104, 114 cases coming out of an outbreak, then we're getting a hold of a lot of people.
I see.
So this one, that's not this particular outbreak, but there's a large capacity to do contact tracing, and a lot of people that are, being reached out to.
So this was a fairly low risk event, and
It was a low risk until we got out of cars and didn't stay 6 feet away from people and didn't wear masks. If
so
you are even outdoors within 6 feet of somebody without a mask on for a period of time, rather than just I passed you by, then that does become a higher level risk.
so then what do you think what do you think that should tell schools and other places when holding these events? Because I'm sure they're trying to figure out safety precautions, but this is all new to people. There's probably going to be like a hole in the road or something like that.
Right. So, they have to prepare for worst case scenario, right? So preparing for worst case scenario in this case means everybody got out of their car instead of staying in their car. Are you prepared for that? What are you going to do? So you have to be prepared for those scenarios. When you plan a safe event, which this was a drive-through graduation. People were going to stay in their cars. When you plan for that event and people start getting out of their cars, then you also have to have a plan for how you're going to handle that if that happens. So I don't know if they did, or I don't know what kind of planning went into that, or whether that was something that was anticipated. But we should be anticipating those things. We need to anticipate people and behavior and not doing the things that we know are safe to do, and rather going, well, I'm going to hop out of my car for a little bit because I haven't seen these friends for a while, and I'm going to go talk to them or whatever. So those things need to happen, as well as, mask wearing and 6-foot distancing. So even if you get out of your car, I understand these kids have been out of school for so long. This was their year to graduate. Some of their, closest friends, they would have been able to celebrate together. They would have been able to walk down the aisle together. And all they want is just a moment to be together, a moment to, have a picture taken of themselves together, those sorts of things. And so can we do that and keep 6-foot distancing and know that we should wear masks when we do that? Or can we just not do that?
So I had another, okay, there we go. Sorry, just forgot it for a second. I know you said that you didn't have a number for the contact tracing, and you probably couldn't share that, but could you say if you've made progress in this?
Oh, absolutely. As soon as we identify a case, we make progress. So it's just a matter of, I don't know how many people this individual was considered to be in close contact with where we would initiate that contact tracing. So that is the information you get from the individual. An individual tests positive, you talk to them and you say, okay, who were you near? Who were you close to for any period of time? And then we get a hold of those people. The other thing is, depending on when they tested positive or when they inform us, yeah, I did start to have a sore throat on this day, we back up 48 hours from that and say, okay, what did you do these last 2 days? And who were you in close contact with? So this is not just about contact tracing at that particular event. This is about contact tracing for 48 hours prior to symptoms, or if they're asymptomatic, prior to a known positive test. Because obviously with an asymptomatic case, it's like, we don't know when symptom onset is. So we have to start with that date in mind.
And how long does it take to contact trace? I would just say in general, I know every case is probably different.
Okay, there's two different things. One is case investigation and the other is contact tracing. So a case investigation is getting a hold of somebody who is positive and going through all of that with them, including talking to them about other illnesses they may have. I mean, there's a clinical, aspect of that goes into the case investigation itself, including identifying who are the contacts. Then that gets, put into the contact tracing. So right now we have people who do just the case investigation and then hand off, typically our people just do both, but then hand off contact tracing to others. So those people may have relatively short phone calls. It could take, no more than a half an hour to talk to somebody, ask them if they have symptoms, ask them, things like, and ask them to self-quarantine. And then basically just educate them on their risks, what to be looking for, the development of symptoms, paying attention to that. We do, people can, we always say, if you want to get tested, you can go get tested. We still require quarantine for 14 days because that can be the outside end of an incubation period. So let's say somebody gets tested 7 days after they knew they were exposed and they test negative. Well, maybe they're a person that's going to have a 12-day incubation period and that negative test just, didn't pick it up yet because it hasn't happened yet. So that 14-day quarantine period with a negative test or not is still basically the recommendation.
And overall, I would just say in all cases, I know the Harpers case, I'll get to that in a second. Overall, though, how would you say contact tracing has been going in the cases in Ingham County?
Contact tracing has been going really well. We've got a great team. They do a fantastic job. They are, I would say, just top notch in the state in terms of doing the job that they do. They are amazing. It's an amazing team. They know what they're doing. They know how to get this done and drill down fast. So, we are already seeing the effects of their contact tracing quickly putting a ring around the larger outbreak that that we know about, and in these smaller things like this, quickly going, okay, this, it's like when it's a smaller thing, which this one was most likely a smaller thing. Like I said, my understanding is most people did stay in their cars. Then there's a limited number of people. You get a hold of them quickly. You get them quarantined. If they're ill, you get them isolated and tested. If they are exhibiting symptoms, then we definitely want testing to happen. If they're asymptomatic, some people want to get tested just for a sense of security. Again, you can get tested 7 days after it. We still require quarantine for 14. So it's fairly fast, and that's how we contain. That is exactly how we're going to keep ourselves contained in this whole situation.
Is there like an average number or a percentage in which people you've contact traced actually test positive for the virus once they've been notified?
No, that's not. There's no, I mean, all situations are different when it comes to that. So I can't, no.
You can't say.
When we do contact tracing, it's like some of the exposures were lower than others, some were higher. People's immune system, sometimes it's dependent on so many factors. So that is just kind of an across the board, all over. That number is all over the place.
While I have you here, I do want to talk about the Harpers situation. So I first want to ask. I know you said you guys have been doing good in your contact tracing. What's the status in the Harpers bar situation?
We have 118 cases identified out of that. 104 of those are what we call primary cases. In other words, we can track back to their exposure being at Harpers during the period of time it was open. And then we have 14 what we would call secondary cases. In other words, they might be a household member of someone who was there, then came home and eventually got sick from that person, or other close contacts outside of having gone to the establishment themselves. So secondary transmission is now what we're most concerned about, and is why we ask people to quarantine. So if we know you've been exposed and you're not sick yet, and we don't know if you're going to become sick, that quarantining for 14 days will keep you from exposing other people and will stop the transmission. So that's how important that quarantine request is. That is how we can stop transmission. Once people are already sick, they're already sick. Then they have to isolate also to keep people from becoming sick. But the quarantine period when, you're feeling just fine and that's frustrating is very critical.
When people, okay, here we go. When someone is contact traced, like let's say, like I know someone, I had contact with someone who went to that bar, and this is just an example. I'm not saying I have, but let's just say I have, and I self-isolate and I get a COVID test and I test positive. So then is my case linked to that bar, or is it just community spread?
Yes, that's that secondary transmission.
The secondary transmission.
Mm-hmm.
Okay.
So you'd have had to have close contact with that person. It's like, okay, here's a person that went to Harpers, and I've been in, and then there's the, it's like when it's a timing thing too, to also establish that it's connected to that. So then you would become one of our cases, and then we would call you and find out who you have been in close contact with for whatever period of time prior to either you testing if you were asymptomatic, or you coming down and saying, oh yeah, I guess I did have a sore throat a couple of days ago. So that will be the beginning of your symptom period. We'll go back 48 hours from that, and then we'll talk to you about that.
So during the governor's press conference today, she showed a map of like the risks that the regions are in. East Lansing is the one that's the highest risk. That's the riskiest.
It is actually not East Lansing. It's Merck Region 5. So it is basically Eaton County, Ingham County, Clinton County, Shiawassee County, and Gratiot County, because we are a region together. That wasn't just an East Lansing red spot. That was those counties that are in that region. So our region has been put into a high risk area.
Okay, give me just a second. My apologies. where there we go. Sorry, I touched something and it took me to
That
another
happens to me
screen.
all the time. I'm used to being at work, and this is like a laptop that's docked in, and I got a keyboard and all that. And then I work on this, and my thumb hits the trackpad, and
Right.
crazy stuff happens all over the place, and I'm like, oh my gosh, what just happened? So
This
yeah.
is like, I have a Mac and like I always have issues with connectivity on Zoom. So I have to use this laptop and it works perfectly. But yeah, I was about to say I did mean Ingham County. I did not, my apologies. I should have been more clear on that.
And it's actually the whole region. So it's
Right.
beyond Ingham County. Ingham, Eaton, Clinton, Shiawassee, Gratiot. We just come together as a region, no matter, the fact that it might be predominantly in Ingham County. That's the region that we are in. So that is the region that was put into high risk.
Right. Given the high risk category and also the situation, particularly at Harpers, do you think that there were 2 reports about this in this area, that the Grand Rapids sector and the Lansing sector, the Merck region, would move back phases. That was reported wrong. But do you think that the Merck sector in Lansing, I forget what, sector 5, I think it's sector 5.
Merck region 5.
Merck region 5. Do you think that Merck region 5 needs to take a step back?
That is the governor's decision. So she was asked that question today on her press conference as to whether or not she was going to move anybody backwards. And she said she was still in, consultation, advisement, deliberations over that. So I don't know at this point in time. As a local health officer, I have authority based on a state appointment to enforce the public health code and to execute orders myself. That is basically the authority of a local health officer vested into you by the public health code. So it is not a matter of I have to go to my governing body and ask them to do it. That is the authority of a public health officer. So, my decision was, after a lot of research and after watching what was going on, was to say that the 50% capacity in restaurants is great, but when we get to the point where we've got like 250 people in a place, that's hazardous inside. And so we went down to a 50% capacity, or 75, whichever is greater. Part of the reason behind that was in Executive Order 110, which we're in right now, we're limited to a gathering of 100 people outdoors. So Executive Order 110 says we can't gather outdoors in any more than 100. And when we do, we have to stay away from household members people who are not of our household. So, but we can come indoors, and in certain places, that executive order also requires indoor gatherings to stay at 10. So there are certain meeting rooms that no matter how big they are, you can only have 10 people in them. But in a bar or restaurant, we can have hundreds, depending on what the fire code capacity is of the bar or restaurant. So that was an adjustment we made based on looking at all of those things, based on looking at trends with hospitalizations, trends in percent positive cases per day, our upward trends in the number of cases, what kinds of outbreaks they're associated with, as well as basically, I did do, some look at, I only got to East Lansing and Lansing because I was trying to make a decision based on data, but not delay too long. I did get a list of bars and restaurants from East Lansing and Lansing and take a look at, okay, if we go to this place, how many places are going to be impacted? So all of that went into trying to make a decision that was in the interest of the safety and the protection of the health of this community.
And to be clear, that decision was just for Lansing and East Lansing?
Ingham County.
Ingham County.
My authority is Ingham County as a whole. And so I don't issue orders that are just Lansing or just East Lansing. It becomes an Ingham County-wide order.
So, and I know that you said you're just the health officer. You enforce code. That's one of your jobs. When you see a situation like Harpers, how concerned does that make you?
Quite concerned, which is why we've taken some of the actions we have, why Harpers is closed and will remain closed until we say that they can open, after consulting with them about what their plans are, how they plan to do things differently, how they're going to keep people safe. Also, basically, deeply concerned about the number of cases, even though they're young people and not hospitalized and mildly ill. We are already seeing exposure and secondary transmission to people who are older, to the extent that that continues, and older people who might have chronic conditions that make them susceptible to more serious illness or hospitalization. That is all of deep concern of ours. And, to just restrict Lansing and East Lansing and not the rest of the county just, sends people out to the other parts. Anyway, just never mind that part. We won't even go there.
It sends people out to other parts of the state.
Other parts of the state, other parts of the county. Just because you were at a bar in East Lansing or Lansing doesn't keep you from now. I live somewhere else in the state, in the county. It's just, the containment strategies are challenging. They are science-based, and it is just something that basically we are vested with as health officers in our roles, to evaluate those things, to make decisions based on the science and the training. And I've been a health officer for over 14 years, over 13 years. And, I've been doing this for a while. So it's not like I'm new at this and kind of trying to guess at what I'm doing. So.
And what was I going to ask?
And guessing, honestly, guessing would not be a good way to do this. It's like, we don't just guess. We use science, we use data, we use trends, we observe what's going on particularly and where the hazard areas are, and then we address those.
And I know you say that we don't guess, but is this also, do you think this is also there's also a concern for what's to come as we go further into this new normal before we have a vaccine?
It is a concern unless we can, we really keep trying to emphasize the things that people need to do to protect themselves, to protect others, and to prevent transmission from getting out of control again. And to the degree to which people don't take those things seriously and adhere to them, then that becomes a risk. And that's what we've seen with this recent outbreak. Groups of people not wearing masks, not staying socially distant, and that is, look at the result of that. So, I don't know how any clearer point out that the types of things that we do that involve distancing and masks and all of that sort of stuff work.
Would you like to emphasize some of those things on here right now? Some of those safety precautions that you mentioned?
Well, the safety precautions start with wash your hands, right? Wash your hands. The other is, we go out places and there's not always some place where we can wash our hands. Until you've washed your hands thoroughly, do not touch your eyes, your nose, or your mouth. Stay 6 feet away from people that are not of your household in public places outdoors, public places indoors. And wear a mask. If you are unable to stay 6 feet away from somebody outdoors, you should wear a mask even outdoors, like the line that we saw. You should wear a mask indoors, always, when there are groups of people. Unless, like, if I'm in my office by myself, I don't have to wear a mask in my office, but I'm by myself. As soon as somebody walks into my office, I'm wearing a mask. So when people go into bars and restaurants and stores and all of those places, they should be wearing masks.
And I also want to talk about go back to the contact tracing here.
And I'll add a couple more things.
Okay.
I can go back to safety precautions. If you're sick, stay home. If we need you to isolate until we know that you're clear not to infect other people, you need to do that. If you've been exposed and we ask you to quarantine, you need to do that. Those are the things that are going to keep us at a level where we don't run the risk of everything shutting down again. And we don't want that. I don't want that. No, nobody wants that again. But if we cannot get to a place where we understand those things and adhere to those things, then what we saw in 1918 with a huge second wave in the fall could happen. This isn't a second wave right now. This is a rebound within the first wave because of, you know, basically lowering our guard on practices that are important.
When you, so like if it were me personally, I don't mean this badly against you or anybody. If I don't know a phone number, I don't answer it because I trust that if there's a human behind that phone, they can leave a message.
Correct.
And that would be the same thing with this. But I want to make sure that people are aware of like who they would get a call from and like what the source of that number would be. So could you talk a little bit about that?
So let me explain that to you. So for one, that is a challenge. So when our staff call out, they're dialing out, and the caller ID will show unknown because, you know, we have to protect them from any kind. I mean, as you know, all kinds of things have happened as a result of this. We've had health officials threatened. We've had health officials with death threats. We've had countless health officials across this country resign, retire, or get fired over death threats and other types of threats. That is happening in this country as a result of us trying to protect the public health. So we protect our people, okay? So they're not gonna call from you in a number that you can just call back. So they will leave a voicemail, but if your voicemail box is full, we can't do that. If the initial contact with you is not possible, we're not going to text you. So the other thing is texting. So after we've contacted you the initial time, we do oftentimes check up with people via text, you know, but we're never going to do that because one of the things we have to do is establish that indeed we have reached the right person and we're not communicating with somebody that is not even the right person and violating privacy laws around that. So we will have to get in touch with you by voice, confirm who you are, all of that sort of stuff first. What we're working on right now through Verizon, which is the carrier for all of our team's cell phones, is to put a outgoing caller ID on that says Ingham County Health Department. So soon, hopefully, instead of unknown, on the other end of that phone, you should see Ingham County Health Department, and that is a call to answer. Dr. Caldoun just said that on the news briefing today. When the health department calls, you need to answer. Agreed, it is challenging when the health department calls and it's a number you don't know. It's like, I don't know this number. So keep your voicemail boxes from being full so that we can leave you a voicemail message and then respond quickly if it's us. And we're doing our best really right now to get a caller ID situation on there so that you will actually know that call is coming from us.
But if our voicemail box is full, you can't text us. Would that mean you can't?
No.
So would they try again and call us back?
So we just keep calling. Yep.
Okay. How, I'm sure that's a concern. How often has that happened in which people just won't pick up the phone?
Oh, it happens frequently. But again, typically we're able to leave a voicemail message and then we have that voicemail message to go to. Challenging for us is when we run into the voicemail boxes that are full and we have to keep trying and trying. So that's one of the reasons that we are looking at this caller ID issue so that basically it will be clear that the Ingham County Health Department is calling.
Do you feel threatened because of, I know you mentioned that these workers, they're trying to make people aware that they might have been exposed to the virus and yet they've gotten death threats.
No, not them. People like me.
People like
Public
you,
health officials that are making decisions, issuing orders, requiring masks, those sorts of things. We're the people getting the threats, including death threats.
do you feel like your life is in danger?
Oh, no, absolutely I don't. But, you know, I have had my share of what I would call fairly low-key kinds of threats. But the health officer in Orange County in California resigned after basically issuing a mask order, which we have in this state already, and a number of comments basically about shooting her and that sort of stuff. She eventually resigned over the safety of her family and herself. And she was a top-notch health official, supported by the American Pediatrics Association out in California, who wrote just a glowing, you know, what a sad thing this is to see her leave. And she's not the only one. I don't know how many we're up to now, but there have been quite a number. So it's usually somebody like me who has to make the tough decisions, that has to stand in front of the public or in front of the media and let you know what they are, rather than the other folks that, you know, get the angry emails, the angry comments, those sorts of things.
Would you say that the majority of people in, I would say I'm going to say Ingham County just because that's your jurisdiction. Would you say that most people in Ingham County are complying with the mask order and social distancing measures?
I couldn't say most, no. I mean, you know, I've seen places where there's been great mask compliance, and I've seen places where there's hardly any. And I certainly haven't been all across this entire county. It's really a mixed bag of compliance with the mask wearing. I understand some of it has to do with, you know, early on we said don't wear a mask, and now we're saying wear a mask. And so it's like, you know, you guys just are switching around on us. But, you know, this evolved on us. We learned about this virus. It was brand new. We had to learn. We all had to learn. And so guidance changed as we learned. Guidance from the CDC to us changed rapidly.
Yes.
And we had to learn and adapt to that. And so we're all learning and adapting as we learn more. And that's just part of it. And so the mask wearing also has been, I think, polarized politically as well. And so it has become kind of a symbol of that, and that is unfortunate. So, you know, we're trying to be, you know, educated, trained public health officials, which we are, and give you our best advice with the best science we know, and tell you that this is important, that this is effective, and that it is critical to do in order to keep us from looking at additional closures. And beyond closures, it's people. It's people who are getting sick, will get seriously sick, more people who will die if we don't get these things back under control again. So that's the bottom line there. We have got to keep people from dying. We've got to keep people from becoming seriously ill. Some of these people who have become seriously ill, you know, they're days and days or, you know, weeks out from their recovery, but they've got some long-term issues that they're dealing with their lungs and other things. So technically they're recovered, they don't have virus anymore, but there's in some cases some lingering effects of having had this illness that may take a long time to resolve.
This might be a question for the school district and the high school. Do you know if the person who got coronavirus from that graduation ceremony, does that person have mild symptoms? As in, are they hospitalized?
Nobody's hospitalized right now.
Nobody's hospitalized.
We have one individual from Ingham County that's in the hospital, and that has been I've seen no increase in hospitalization of Ingham County residents. I haven't looked at the outbreak numbers or the numbers from anything specific, but I haven't seen anything about hospitalization. None of the cases related to the Harpers outbreak are hospitalized at this point in time.
Right. Is there any other advice that you want to give people?
No, but you can cut out that part where I said guess. Let's not make people think I'm guessing.
Okay. I will do that.
Just don't use that, okay?
Okay. And then is there anything else that you wanted to say?
No, I can't think anything else.
Okay. Alrighty. I think that's all I have. Thank you so much.
Okay. Thank you.
Take care.
You too.
Bye-bye.
Bye.